Hi, my name is Crystal Ortiz. We're going to start module number 3 for the medical terminology class at TWU. Alrighty, so we're going to pretend that I am a nurse and my patient is Lucy, okay? So, hi Lucy, my name is Crystal Ortiz. I will be your nurse for today. And we will just go into details as to how today is going to run out and the procedures, the steps, what is your condition, what should you do after surgery, and etc. Okay, so first we're going to start explaining the purpose and goals for your surgery. So the purpose of the surgery will be to remove all the cancer cells that are located in your skin. Okay, and so for you, this area we're talking about the area that's beside your nose and below your eye. So this part, okay? So the type of cancer that you have is basal cell carcinoma, which is a type of cancer that affects the deepest layer of your epidermis. Your epidermis is one of the 3 major skin layers, while the other 2 are your dermis and subcutaneous tissue. One can attain this type of skin cancer when there's a combination of cumulative and intense occasional sun exposure. Basal cell carcinoma looks like sores, red patches, pink growths, shiny bumps, or scars. Okay, I know you did mention that you go to the sun in several occasions, so that might have affected or developed this cancer. Okay, the doctor that will be performing the surgery is an oncologist surgeon. An oncologist is specialized in evaluating and treating people with cancer. Therefore, the oncologist is a specialist in cancers that deal with the integumentary system, meaning the skin. Okay, so the procedures that will be involved during the Mohs surgery will be first, the surgeon examines the spot where the biopsy was done and marks it with the pen for reference. Then a surgical drape is placed over the area, which will be surgically acted upon on. Thirdly, local anesthesia will be injected so that you won't feel anything. You will not be asleep, but you will feel numb. So you won't feel anything that's going on around your cheek area, which is really good. Okay. Next, the doctor will remove a thin layer of cancerous tissue with a scalpel. The scalpel is just a small knife that has very sharp end, but you won't feel anything because you are under anesthesia, so no worries about that. The layer removed will then be analyzed to determine if the tissue has root extensions that are not visible to the surface. Then the wound will be then bandaged for a while the doctor performs the analysis. The surgeon will then cut the tissue into sections and color code them with dyes. Then the lab technician will perform a cross section. The surgeon then will examine the tissue by using a microscope. Once analyzed, the doctor will decide whether to remove another layer of skin tissue. If more tissue needs to be removed, the surgeon will inject more anesthesia. The process will be repeated if the tissue analyzed showed cancer cells. Once the site is cleared, the wound will be closed using stitches. Okay, and the stitches will not hurt because you are still under anesthesia. So you may be asking yourself how long this will take, right? So the procedure will depend on the amount of rounds the doctor will perform. By rounds, I mean the number of times the skin tissue is being removed and analyzed. The more times the skin tissue is being removed, the longer the surgery will take. Okay? So, another thing that I would like to talk about would be the importance of wound care and following the discharge instructions in minimizing this risk, right? So if possible, the patient is not allowed to remove the bandage for the first 24 hours. After the 24 hours, the patient can clean the wound while rinsing water towards the soap and patting the area dry. Patient may insert any type of ointment and rebandage the area. Patient should repeat the process every 24 hours. Patient ought to follow the discharge rules because the wound may reopen or get infected. Okay, so since you are getting stitches and you are getting facial stitches, the best time to return to the clinic to get the stitches removed will be that of 4 to 5 days. Therefore, I would like for you to come in any day of next week to get the procedure done. All right, thank you so much, Lucy, and I hope you have a great day and way to kick cancer's butt.